Well, thanks so much for being with Morning Live. Let's go over to KwaZulu-Natal now, where South Africa is hosting the latest AIDS conference, and 8 million or close to 8 million South Africans are currently living with HIV. And this, of course, makes us the epicenter of the disease globally. KwaZulu-Natal carries the bulk of these infections, and with the rise in new infections post the COVID-19 pandemic and the burden remaining on young women in the main in sub-Saharan Africa, we have scientists, NGOs and policymakers converging in Durban for the 11th SA AIDS conference that starts today. So for more on this, we cross now to our reporter, Jade Paulser, to give us a sense of what to expect today and, of course, what's happening in the build-up to the start. And Jade, good morning. Seems like a beautiful morning out there in Durban, but, of course, activity behind you already. Please talk us through it.
Well, a very good morning to you, Sakina. And yes, the excitement is palpable. We are talking about a very important matter close to our hearts here in Durban, but also in South Africa. 8 million people, like you said, Sakina, infected with HIV. Just looking globally, 38.4 million people. And if we bring it back home, we've got 5.5 million people on antiretroviral. 50,000, the National Health Department saying 50,000 people are succumbing to HIV and AIDS, complications. And then we've got 2 million undetected. So this is really becoming a very, very critical issue. And post-COVID-19, well, we still have COVID-19, infections on the rise. But post-COVID-19, after 2 years, we've seen a spike of HIV infections in South Africa and across the globe. But to talk about the march that is going to be happening at King Dinizulu Park and leading to Gugu Dlamini Park, I am joined by Nelson Dlamini. He's from SANAC. He's the communications manager. Thank you so much for joining us, Nelson, this morning. A very important march ahead of the conference this morning. Talk to us about the title of this march. We're going into reproduction, sexual reproduction, and linking the two, marrying the two with the HIV and AIDS epidemic that we have in the country.
Yeah, good morning, Jade, and good morning to the viewers of SABC. So when you look at the challenges we have in the HIV response in general, it all boils down to how sexual and reproductive health services are provided, and the equal and equitable access aspect of it is important. We have key and vulnerable populations such as transgender women, but also when you look at young people who are hardest hit when it comes to HIV infections. I mean, adolescent girls and young women between the ages of 15 and 24, we record about 1,300 infections per week, and they also experience challenges when they go to health facilities. Youth-friendly services are something that we are trying to scale up and promote. So this march is looking at all these issues to say, in as much as government is making efforts, but the people on the ground also should know that there are these services, they are accessible, and how young people should be accessing them. It's an advocacy march. It's not a march to fight against anything. It's just an advocacy march to say, as the SANAC Civil Society Forum, this is our contribution to the response, to say, look, we also want to play our role in assisting government efforts.
You know, after COVID-19 pandemic hit South Africa, we've also seen a rise in the number of HIV infections. And in fact, after 15 years, the mortality rate is higher than ever. Nelson, talk to us about what is being done on the ground. Durban, KwaZulu-Natal still remains the epicenter of this disease.
Yeah. Look, COVID-19 really put a spanner in the works. It disrupted HIV and TB services severely in terms of human resources, in terms of financial resources. And then what we did as SANAC, in fact, 2 months into the lockdown in 2020, we brought together key stakeholders. Among them was the Department of Health, of course. And out of that engagement, engagement, we came up with HIV and TB catch-up plans, and that was looking at the issue of integrating services just to mitigate against all those disruptions. And KZN is still hardest hit, but when you're looking at how it's responding, it's very encouraging. I mean, this is a province that was the first in the country to have a district that met the 1990 targets of UNAIDS, the deadline of which was December 2020. They met them ahead of the deadline, and that was King Cetshwayo district, which was quickly followed by Ugu district. So it's making progress in as much as it's hardest hit.
Well, thank you so much for talking to us, Nelson, about this, and we look forward to talking to you further as the conference proceeds. Well, that was Nelson Dlamini. He is the SANAC Communications Manager. This group will be leaving King Dinizulu Park, and the march will be moving to Gugu Dlamini Park, and this is very symbolic, as Gugu Dlamini was the first South African to come out in 1998 and disclose her HIV status. Those that know the story will know that she was stoned after a televised interview on the news. She was stoned by the community of KwaMashu for revealing her status. Well, we'll be bringing you the latest of the HIV and AIDS conference that is being held here in Durban, but for now, let's go back to an ad break.